Hi, welcome back to AirSculpt TV. My name is Fatima. I'm one of the patient care consultants in our Beverly Hills location. Today we are bringing you a gynecomastia procedure with Dr. Konevsky. But before we step into the OR, we did want to go ahead and answer some live questions that we're getting in. So with summer around the corner, one of our most commonly asked questions is when can I go back to the pool? When can I go back to the beach? Our doctors ask that you refrain from going to the beach, pool, submerging yourself in bodies of water for at least 2 weeks after your procedure, just to allow those little entry points that we're making to heal and close. What is recovery like? So with AirSculpt, there's very little to no downtime. Our patients are able to get back to their regular lifestyle within a couple of days and back to strenuous activity like working out or going to the gym in 2 weeks. And how quickly can you see results? Well, our patients can even see results on the table. However, we do let our patients know that your body does need time to recover, and your final results typically come in around the 6-month mark. If I'm traveling, when can I fly? You are able to fly typically about 48 hours after your procedure. Is there a BMI or weight limit with AirSculpt? There is no BMI or weight limit with AirSculpt. We treat patients from all shapes and sizes. And how much fat can AirSculpt remove? We are able to remove 5 liters of fat in one sitting. And lastly, how long do I have to wear my garment? So our surgeons require you to wear your compression garment for 2 weeks after your procedure. However, you can wear it as long as you want if it feels comfortable. So we're going to go ahead and walk over to the OR and check on Dr. Konevsky. So when you're coming into our Beverly Hills location, we will be taking you down this hallway into our beautiful exam rooms, where the surgeon will examine you and determine a customized treatment plan. And then right around the corner, we have our surgical hallway, where we will be meeting up with Dr. Konevsky. So before we step into the procedure, we are going to go ahead and gown up, and we'll see you shortly.
Hi everyone, we're here in our Beverly Hills location with our lovely patient Sean today and Dr. Konevsky, one of our AirSculpt physicians.
Hi everybody.
We are doing the male test today. So let's just turn over to our patient Sean. Sean, what made you want to choose AirSculpt for your procedure?
Well, I think it's the best in the business, and I like being awake and not general anesthesia. I think that's better.
Awesome.
Watching video and everything, I think it was the best decision.
Fantastic. And how are you feeling so far?
I feel good. It's a little bit stinging, but it feels good.
Awesome. And what do you like about being awake versus general anesthesia?
I think it's just a little bit more risky, and maybe having a little more hands-on being awake. Good.
Awesome. Yeah, a lot of our patients, they also agree they prefer to be awake for their procedure just because it helps with the recovery, the downtime. They're able to bounce back into their regular lifestyle within a couple of days versus with traditional, it does take a couple of weeks to get back to your lifestyle. We can go over ahead and hand over Dr. Konevsky.
All right.
Hey,
Hi everybody.
Hey, Dr. K.
How's it going?
So how is our lovely patient doing?
Sean is doing fantastic. He's been super comfortable. So even though we're working on the chest right now, we've actually already completed doing the chin and the upper and lower abdomen. Sean's been absolutely a pleasure to work with. So right now we're focusing on the chest area. You can already start to see the difference. We've worked on the left side, which is much lower and flatter. We haven't touched the right yet, but you can already see the difference. And what's great about this procedure is that, even though both men and women have breast tissue, we're able to get a really good amount of the fat out from behind the breast gland, which really makes a nice difference.
Fantastic. Dr. K, how much fat would you estimate that we've gotten out so far?
Just from this side alone, we got about 300 cc's, which is about a little more than a can of soda.
Oh my goodness, that's amazing.
Yeah, and if you pan over to that canister, you'll see how much fat we got out from the rest of it. And that's just from the upper and lower abdomen, almost 2 liters.
Awesome. Yep. Sean, you are going to have a phenomenal result. I'm so excited for you. And Dr. Tate, can I ask you, why do you like doing AirSculpt? Why do you prefer doing AirSculpt over other forms of fat removal?
So I've done thousands and thousands of traditional liposuction procedures, and nothing compares to doing this awake with patients comfortable, relaxed. The recovery process is way smoother, and I'm able to really achieve more sort of finesse, aesthetically appealing results.
Awesome. What kind of music were we listening today in the OR?
Who we're listening to is Rufus Wainwright. Yeah.
It's a great choice, great choice. And Sean, how does it feel to watch your fat being removed from your body?
Well, I think it's much better than being under. So you're sort of in control to see what's happening. Yeah.
Awesome. Well, and Sean, lastly, do you recommend AirSculpt? Would you recommend AirSculpt to your friends and family?
Yes.
Awesome. Well, thank you so much for being such an amazing patient, Sean. We want to say a big thank you to our fantastic surgeon, Dr.
My
Tay.
pleasure. Thanks for joining us, everybody.
And we'll let you guys get back to it.